Hi listeners, currently we are on the topic of health insurance. Now I'll be talking about next coverage, namely domiciliary hospitalization. We have already told that the hospitalization is the main cover under a health insurance policy and everything revolves around hospitalization. And we have explained that hospitalization means that the condition of the patient should be such, he needs minimum 24 hours admission in the hospital for treatment. Now, what do you mean by domiciliary hospitalization? Typical domiciliary means at home, stay at home. That is what the meaning of domicile means. Domicile country, or native country, domicile state, where you are residing, like that. So domiciliary hospitalization means what? Taking treatment at the treatment which you are meant to be taken at hospital, you take that treatment at home. That is called domiciliary hospitalization. Now, here, there are certain conditions to be fulfilled. Either that the condition of the patient is such that he cannot be taken to hospital, he needs to be treated at home, or there are no beds available in the hospital. This situation we saw during the COVID times, where the hospital beds were all full and many of the patients were advised to take treatment at home. So, but then either in both the situations, the practicing or the medical practitioner has to give a certificate that domiciliary hospitalization is required. And the policy conditions generally say that the minimum period of domiciliary hospitalization should be 3 days, 72 hours. That's what they say. Further, you have to be very careful here. Most of the policies, or whichever the policies we have come across, says that pre-hospitalization and post-hospitalization expenses are not applicable for domiciliary hospitalization. So this we should be aware. In future, they may include pre-hospitalization and post-hospitalization for domiciliary hospitalization also. But currently the scenario is such, pre and post-hospitalization cover is not available for domiciliary hospitalization, which you should all be aware of. Why we insist on is that we should not think that pre and post hospitalization coverage is available for domiciliary hospitalization and have a kind of an expectation that insurance company will pay for those expenses also. No, currently it is not the situation. Okay. We also told that health insurance policies are highly customizable or as to highly customized products. Maybe there may be some policies which may cover pre and post hospitalization, which you should check it before. If you feel that pre and post hospitalization should also be available for domiciliary hospitalization, but as of now, most of the policies do not cover pre and post hospitalization in connection with domiciliary hospitalization. Thank you very much.